I'm Christine Lawler from the Peaceful Mind Counseling Center, and today we have Dr. Bennett with us to answer some of our most frequently asked questions about the ketamine process and what that looks like. So thanks for joining me.
Yeah.
Okay, a lot of people hear about ketamine and they think club drugs or recreational drugs. So how does ketamine actually work? What does it do?
Sure. So to address your first point, basically every anesthetic that people get every time they go to the hospital have been used in a club at one point or another, right? Like that's the reality of anesthetics. Even people who've had negative experiences with ketamine before, because I have quite a few people who come in who said, look, I feel like I need this because I'm depressed and I have all these problems, but I tried ketamine once and it was a really negative experience. And I always ask, okay, well, what was the where were you? What was the context? And they say something like, it was 3 a.m. and I was at EDC and it was like blasting lights and music, and it was a very chaotic environment.
And I've been drinking all night.
And I've been drinking, and ketamine is, the experience with ketamine is largely driven on the environment in which it is administered. So if you're in a room such as this, where it's nice and calm, people feel safe, and it's being administered professionally, then it almost always goes very, very well. Yeah. But if you take it at a rave, or you're at Burning Man and then you take ketamine, then yeah, it's going to be a pretty rough experience. And then speaking a little more to the experience, one of the beauties of ketamine, especially with IV ketamine, is that I can really closely control the amount that's going in, and I can control kind of, if someone starts to feel anxious, I can treat it. I can take care of it right away. Another thing that I get all the time is someone comes in and they say, yeah, well, I did a marijuana edible once, and for 12 hours I was stuck in this like horrible abyss of an experience and I wanted to die. It just doesn't happen with ketamine because the liver metabolizes it so quickly that basically as soon as I turn the infusion off, people start to come right back to kind of their reality. And so it's very easy to control and keep it a really nice kind of mellow experience. Yeah. And then particularly when we do ketamine with a therapist such as yourself, it's even better because then you're able to kind of talk through and work through whatever problems you're going after.
Yeah, there are two things about that I'll kind of jump on. One, there's a lot of buzz about a lot of psychedelic medicines, and what I love about ketamine, especially for somebody that hasn't used psychedelics before, is that it's very quick. If you're not having a fun time, you can turn it off. If it's hard, it can be done so quickly. Whereas something like LSD, for example, like if you're not having a good time, you're kind of in it for 12 more hours. And There's not a doctor administering it.
Correct, yeah.
The other thing I really like about ketamine is even if you're having a challenging experience, which can happen because we're dealing with brain trauma, even if you're having a challenging experience, if you're not having a fun time, the medicine was still effective. Correct, and so, a lot of people, like sometimes I think about it like a deep tissue massage. Like you can go get a deep tissue massage and really not be enjoying yourself, but you're still consciously aware enough to know, like, this is hard, but it's good. It hurts, but it's healing.
Correct.
I can navigate this. So I've had patients, that aren't necessarily having a great time, but I'll ask them, like, do you want to be done or do you want to keep going? And they say, like, no, I need to keep going. I know that I need this. Mm-hmm. So there is an element of, like, healing's painful sometimes. Think about any medical procedure. It's not always a picnic.
Right.
But overwhelmingly, it is a positive experience. Overwhelmingly, people have these feelings of peace and these breakthroughs. So the negative experiences, or people talk about a bad trip, it's very rare, but also it's like not that bad.
Correct. And the reason I think it helps in multiple ways, one is just the effect of the medication is very helpful, right? But from combining ketamine with the therapy aspect, you know better than me that when you're dealing with PTSD, the things that people have gone through are so painful and so traumatic that it's very difficult for you to do your job because they don't want to talk about it because they don't want to relive these whatever they went through, whether it was one event or repeated events or whatever it was, whatever traumatized them, they don't want to talk about it. And so it makes it really difficult for you to administer effective therapy.
Yes.
And quite frankly, it's more expensive for the patient because they have to go to you 100 times before you even get a breakthrough. Because maybe if you have an hour session, maybe you're getting in 5 to 10 minutes of quality work. Whereas when we combine the ketamine with the therapy, if you've got an hour session, 50 minutes of that is going to be very, very high quality work for you.
100%.
Because it disinhibits the brain enough that for someone with PTSD, they can talk about it without it being a hugely painful event.